Hi, my name is Mallory Rose, and I will be teaching you about the two case studies that I chose and why I got the answers I did, and I will be explaining that. So, the first problem that I chose to research said a 5-year-old boy is brought to the pediatrician's office for an annual visit. The mother reports he has been a sickly infant and often appears drowsy. She also has concerns over her son's persistent thirst and frequent urination. Blood samples are taken for insulin measurements at time 0 and 1 hour after a glucose loading test. The results of this testing are illustrated in the table that we were provided. The table shows the boy's baseline blood sample, which shows his serum insulin levels to be at 0.8, while the control group should have serum insulin levels at 6 plus or minus 2, which would either be 4 or 8. So the boy is extremely low. And 1 hour after the glucose loading test, the boy has serum insulin levels at 5, and the control has serum insulin levels at 40 plus or minus 11. So that's either at 29 or at 51. The boy's serum insulin levels are very low compared to what a normal child would have. The mother also says that her son is persistently thirsty and urinates frequently. Because the glucose in the blood is not getting used up, this then leads to increased thirst, which then leads to frequent urination. This information suggests that the boy has type 1 diabetes. Due to the fact that the boy is presenting with symptoms of type 1 diabetes, he would have a high blood glucose level after fasting. A normal fasting blood glucose level is less than 100 milligrams per deciliter. If the fasting blood glucose level is above 126 milligrams per deciliter, then this means that the patient has diabetes. While there will be many enzymes active in the little boy, 2 of them are phosphofructokinase and hexokinase. That is the first problem. And then the second problem that I chose to research says, a previously healthy 2-month-old female presents with jittery spells several hours after breastfeeding. Her mother reports she has not given the baby anything to eat other than breast milk since birth. The baby has only recently been sleeping for more than 2 hours between feedings, and that's when the mother reports these symptoms started. The laboratory results are consistent with hypoglycemia, low blood glucose, but are otherwise unremarkable. Epinephrine is administered and there is no increase in blood glucose, but there is an increase in blood lactate. The physical exam reveals a liver edge 4 centimeters below the right costal margin, and percussion of the right chest and abdomen confirms hepatomegaly, which is the enlarged liver. Blood glucose levels increase after breastfeeding, but she cannot maintain blood glucose levels within a normal range during fasting. When asked what the baby is presenting with, I found that the baby is presenting with glycogen storage disease. Glycogen storage disease is a disease where the body does not correctly use and store glycogen. The patient is missing an enzyme in their body that is able to break down the glycogen. Symptoms of glycogen storage disease that are consistent with symptoms that the baby is presenting are hypoglycemia, an increase in blood lactate when epinephrine is administered, and an enlarged liver. Glycogen is not able to form properly in people that have glycogen storage disease, which is why the infant is presenting with an enlarged liver. Now I will go through the 3 other diseases that we were to choose from and talk about why each one is not the correct answer. The baby does not have hereditary fructose intolerance because babies that have this disease present symptoms of poor feeding, vomiting, convulsions, irritability, intolerance to fruit, and there are other symptoms, and the baby does not present with any of these. The baby does not have galactosemia. Symptoms of this are refusal to eat, vomiting, jaundice, and cataracts. The baby does not present with any of these symptoms. And the baby also does not have glucose 6-phosphate dehydrogenase deficiency. Symptoms of this include a rapid heart rate, fever, jaundice, shortness of breath, and some other symptoms. And the baby does not present with any of these symptoms, which is why I came to the conclusion that the baby has glycogen storage disease. So that is my finding on the 2 case studies, and thank you for watching.